Our border, a vibrant, bustling binational metroplex linking two diverse countries and providing a foundation for international cooperation, trade, and prosperity. More recently, however, the border has divided the people of San Diego and Tijuana and our respective nations over a wide range of issues such as immigration, the environment, drug enforcement, and national security. Some San Diegans and members of Congress are focusing greater attention on terrorism and homeland security and the need to rethink immigration policy as a means of fortifying the international border. Residents of Tijuana are more engaged with issues of public safety and concerns over drug-related violence and kidnapping. Regardless of how secure the border ultimately becomes, or how many miles of triple fencing ultimately get laid, the fact remains that the border between San Diego and Tijuana, the busiest in the entire world, is becoming increasingly blurred by the constant flow of people and goods. 44% of California's foreign-born population comes from Mexico. With communities like Oceanside and Escondido in North San Diego County, as well as those in Orange, Riverside, Los Angeles, and counties further north facing issues and challenges similar to those found along the border, the strict geographical definition of the border is becoming more and more impractical. No one issue best characterizes the obscuring of boundaries more than border health, in particular, the health and well-being of this region's children and families. The blurring of American and Mexican lifestyles and eating habits, coupled with a post-NAFTA supersized fast food culture, has led to marked increases in type 2 diabetes, obesity, and increased risk of cardiovascular disease. Additionally, a lack of culturally competent care, information, and access to health care are contributing to a rise in infectious diseases like HIV/AIDS, tuberculosis, and other preventable diseases. The cross-border health challenges in the Los Californias region are daunting, but fortunately, our region is blessed with some truly committed nonprofit institutions working hard on both sides of the border. Their dedication and commitment are helping children in our border region live healthy, happy lives. Tuberculosis, a disease once thought to be eradicated in most of the world, is on the rise. In 2006, Tijuana had over 600 reported cases of TB. San Diego had 362 cases. A growing number of affected children in our border region are contracting a unique bovine strain of TB, attributed to the consumption of Mexican cheese made from unpasteurized milk. Additionally, the rate of infection for HIV/AIDS is increasing in our border region at an alarming rate. This is a particularly worrisome trend when you consider the special impact the disease has on women, who can pass the virus on to their newborns.
Infectious diseases are caused by, different conditions that affect people. In terms of children, we do have well baby clinic projects where we enroll children under 5 years of age and provide them with immunizations for infectious diseases. We do the work through community health workers who learn to do it by themselves. We work in 10 of the most vulnerable communities in Tijuana.
The auxiliary of the Tijuana General Hospital, in collaboration with UCSD Medical School, is just one of the many organizations stepping to the fore. The auxiliary addresses the needs of Baja California's critically ill children, including those that are inflicted with tuberculosis and HIV/AIDS infected infants. Another auxiliary group of the hospital is the Asociación Niños con Cáncer, AC, which is focused on the growing problem of childhood cancer.
Sí, Tijuana es una ciudad muy peculiar al resto de la ciudad de la República. ¿Por qué? Porque mucha gente del resto del país viene con el fin de pasar a Estados Unidos a trabajar, ya con los niños enfermos con leucemia, y vienen siendo tratados aquí en Tijuana en nuestra unidad de quimioterapia. Por otro lado, con las restricciones recientes en las aseguranzas médicas para pacientes con cáncer en Estados Unidos, las 2 últimas semanas nos tocaron atender a 2 niños, uno de ellos ciudadano americano y a otro residente legal de Estados Unidos, los cuales no reunieron suficientes requisitos para continuar su tratamiento allá, y naturalmente los aceptamos y proseguimos con la quimioterapia por el resto de su enfermedad aquí en nuestro hospital.
For Tijuana's cancer-stricken children, Fundación Castro Limón is providing long-term care and attention.
La Fundación Castro Limón es otra de las organizaciones a las que estamos apoyando. Recientemente les acabamos de dar un donativo de $65,000 que procuramos con ellos, con una fundación mexicana. Y este dinero se utilizó en una maquinaria muy importante para el estudio de estos niños con cáncer.
Fronteras Unidas Pro Salud, through a unique binational partnership with MexFam and Planned Parenthood of San Diego and Riverside counties, is reducing the risk of reproductive health problems by providing basic and reproductive health care and sexual and reproductive education for families in the impoverished rural and urban areas of Baja California. They are enabling women and men to manage their own reproductive health and the health of their children. Thanks to the support of the International Community Foundation, Fronteras Unidas is also supporting a health clinic for families at the Escuela Bezacua, Tijuana's first Spanish mixed-tech bilingual school, located in the community of Valle Verde in eastern Tijuana. Throughout the border region, health threats associated with non-infectious diseases are also on the rise, particularly among children. Along the immediate border between San Diego and Tijuana and the Imperial Valley in Mexicali, the incidence of childhood asthma is growing due to the persistent air pollution attributed to border traffic and particulate matter. In Tijuana, over 49% of school-aged children are obese, according to a recent study by the Hospital Infantil de las Californias, and childhood diabetes is on the rise. Tijuana's problems with obesity and type 2 diabetes are mirrored on the U.S. side of the border. In Tijuana, Hospital Infantil de las Californias is providing our border youth with state-of-the-art medical care. Hospital Infantil has also reached out to Tijuana's schools, promoting expanded physical education programs with the aim at improving the health of school-age children and reducing childhood obesity and the related complications. And the organization Los Niños is providing nutritional guidance on both sides of the border.
The basis for Los Niños' intervention in nutrition and health has been through the development of a series of courses in what we call nutrition and ecology. And the nutrition portion is very basic and is quite focused on low-cost meals. The ecology portion is quite focused on community and family gardens.
Other important Tijuana institutions include the Mexican Red Cross, which provides basic care and ambulatory services to communities throughout Tijuana, including many otherwise out-of-reach colonias. Fundación Codet, for its part, provides vision care to families who, if not for its support, would go without the gift of sight. On California's side of the border, San Ysidro Health Center is providing a growing number of immigrant children and their families with access to healthcare services that would otherwise not be available. Their dedicated efforts are reducing the incidence of otherwise preventable diseases and improving the health of California's ever-growing Latino community. United Healthcare is providing culturally tailored, affordable health insurance programs to Latinos in the region.
California has almost 6.5 million uninsured, and more than half of them are Hispanic. As a matter of fact, Hispanics are more likely to be uninsured. Affordability is a factor, but it's not the only factor. It's also knowing how people access healthcare, how they make healthcare decisions, and how they understand healthcare. It's very important that we have providers that understand the Hispanic community, because it's a proven fact that when a patient fully understands the instructions that their doctor is giving them, there will be better compliance and better healing.
Today, more than ever, the border has blurred. Because disease does not discriminate and health concerns are not confined by lines on a map, it is important that we think and act beyond traditional cultural barriers and boundaries to address the critical healthcare needs for our binational Las Californias region. With the health and well-being of our children at stake, we can no longer approach the region's problems with an us versus them mentality. We are all in this together.
We need everybody to reach out to our elected and appointed officials to show that all of us understand the importance of border health to both nations. and that it's a win-win situation for one and all if we commit resources, energy, and knowledge to border health issues.
The San Diego-Baja California region faces many unique healthcare challenges, but we have many important nonprofits here in this area that are providing practical solutions to address many of these needs. These groups need our support. Philanthropy has a role to play. Each and every one of us in this region can make a difference by contributing to the nonprofits that are working to make San Diego, Baja California a healthier place to live.
The International Community Foundation and Fundación Internacional de la Comunidad, along with our fellow community foundations of the U.S.-Mexico Border Philanthropy Partnership, invite you to do your part to make our shared border a healthier and safer place to live for our children and their families. It is our shared border. It is our shared destiny.